So I am doing my presentation on Klebsiella pneumoniae. Klebsiella pneumoniae is a member of the Enterobacteriaceae family. It is a gram-negative microbe, which means that it has a thin peptidoglycan layer, which is surrounded by another layer. It is non-motile, which means it really can't move independently. It's encapsulated, which means that it's encased by another layer of protection to protect it from other, toxic compounds. This particular microbe is great at consuming sugars, and converting it into other components such as like lactic acid, which is in milk and yogurt. This microbe does not require oxygen to grow, and it is rod-shaped. So with this, Klebsiella pneumoniae was founded by a German scientist by the name of Karl Friedlander in 1882, and he discovered this by just isolating it from a person who had died from pneumonia. Originally, the name that they gave it was Friedlander's bacillus, but by 1886 they had changed the name to Klebsiella. So some fun facts about this particular microbe is that it is found in human intestines and feces. So it is an opportunistic microbe, which means if it leaves its natural habitat and travels, to another part of the body, it can cause, diseases or infections. This microbe is spread through direct contact with an infected person. Anybody who has like a weakened immune system already from another illness are more likely to contract it more so than a healthy person. So that's why like hand hygiene is especially important in the healthcare settings. In healthcare settings, patients can be exposed to like this microbe when they are put on vents, or they have open wounds, or things such as IVs. Some of the Klebsiella bacteria produce this particular enzyme that makes it resistant to a class of antibiotics known as carbaminoms, which makes it even more difficult to treat. So what are some possible infections of Klebsiella? So one possible infection of Klebsiella is pneumonia, and some of the symptoms that go along with that are cough with phlegm or pus. You can even have a blood-tinged sputum. You can have fever, chills, difficulty breathing, and even wheezing. Another type of infection would be a bloodstream infection, which can in turn lead to sepsis. Some symptoms that go along with that would be low blood pressure, confusion, organ dysfunction, such as your kidneys. Your kidneys will slowly stop producing urine. So that would be like a low urinary output, fever, or you can even have a low body temp. Another possible infections would be a urinary tract infection. Some symptoms that go along with that would be pain and burning while urinating, frequent urination. You can have cloudy urine or blood-tinged urine. I know specifically in the elderly, confusion is another symptom, and you can have a strong odor from your urine. Another infection, which is quite rare but deadly, would be bacterial meningitis, and those symptoms include neck stiffness, headache, fever, and sensitivity to light. how are all these infections diagnosed? So typically with pneumonia, with bacterial pneumonia, it is diagnosed with a chest x-ray. Another way to diagnose it would be a sputum culture. With bloodstream infections, blood work is typically done where they look at your white blood cell count, and if it's high, that means that you have some kind of infection present. Another way to diagnose a bloodstream infection would be vitals, low blood pressure. You can have a fever. I'm pretty sure nausea and vomiting would be another way to diagnose that. Urine analysis with culture is another way that you can diagnose sepsis. They can, culture your urine and see what kind of bacteria are growing in your urine. A UTI is typically diagnosed with a urine analysis with culture. Imaging is particularly used when a patient has frequent UTIs and aren't really responding to the antibiotic treatment. Meningitis, which is the infection of the membranes around the brain and the spinal cord. A lumbar puncture or a spinal tap is usually used to diagnose that, where they pull spinal fluid from your lower part of your back. Imaging would be a way to diagnose it. An MRI would be used. It can also be diagnosed through throat and nasal swab and blood work as well. What treatments are used? So your treatments vary depending on where the infection is in the body and early detection. So early detection plays an important role in the prognosis of a particular infection. So for UTIs, although they can be difficult to treat with this particular microbe, it is treated with, cephalosporins and quinolones, and it usually resolves 24 to 48 hours after treatment, and you can expect a full recovery from that particular infection. Pneumonia is also difficult to treat, but it also mimics pulmonary tuberculosis. By that, I mean that it also forms these cavities inside your lungs that kind of looks like TB. Again, cephalosporins, carbapenems, and this particular infection can be fatal if not caught. Meningitis, which is rare in adults. Again, early detection is key to recovery in this particular infection. This particular infection has a quick progression with a poor prognosis. It's usually treated with cephalosporins and intravenous antibiotics such as meropenem. Bloodstream infections are systematic infections. They require immediate treatment. They treat it with antibiotics, usually cephalosporins, quinolones, and sometimes a combination therapy of different antibiotics where they use one or two combinations of the antibiotics. And this particular infection has a poor prognosis as well. Okay, so this is the end of my presentation. I have learned so much as I did this particular project, and I can't wait to continue to learn on how these microbes can affect our daily lives. Thank you.